So our first question to get started, how does ketosis and Virta's treatment affect heart health and cardiovascular risk?
Well, Catherine, that is a really great question and one we get all the time. And the exciting news that I have to share is we recently published a paper on this exact topic. So our paper looking at our 1-year results and cardiovascular outcomes again was recently published, and I encourage everyone to follow the link and read it for themselves. But let's talk about some of the really important highlights in the trial. So, Catherine, of all the risk factors that we looked at, and there were 26 altogether, the Virta treatment improved 22 of those. So, I mean, from a big overview standpoint, that's pretty remarkable. But now let's look a little bit more at some of the granular details here about things that patients are asking about. So one of the really important things is that patients who have insulin resistance, prediabetes, or type 2 diabetes very often struggle with something called atherogenic dyslipidemia. And let's pause for a minute and break that question down, or break that term down. Atherogenic dyslipidemia means essentially atherosclerosis causing cholesterol. And so what is this atherogenic dyslipidemia? What it is increased triglyceride levels, decreased HDL or good cholesterol, and LDL particles that are very small and dense. This is really the hallmark of atherogenic dyslipidemia. And once again, important to stress how very common it is in the insulin-resistant patient population. So what happened with atherogenic dyslipidemia in our trial? Catherine, the results were really remarkable. Triglycerides decreased by almost 25%. HDL or good cholesterol went up by almost 20%. And those small dense particles, what they did is they became large buoyant LDL particles. So it's really important also to note that there's no medication that can do this.
It's pretty awesome.
This is just by changing what you're eating. Can drastically improve something that is a big cardiovascular risk for this patient population. But one of the other important things that we get questions about all the time is, I know that my diabetes may be reversed and all these other improvements may occur, but what's going to happen to my LDL cholesterol? Well, again, we looked at this very specific question in our 1-year cardiovascular risk outcomes paper. And what happened? Well, LDL-C, or LDL cholesterol, did increase slightly. However, and this is really important, when we look at cardiovascular risk factors in a insulin-resistant patient population, what becomes a much better marker of risk when it comes to LDL is LDL particle number. So how many LDL particles are there? Another term for this is the ApoB. This is really looking at how many particles there are that potentially could cause problems with heart disease. And what we saw is that these were unchanged through the year. And that is really important. So the question that we get asked all the time, I mean, the really root question is, I can make all these other things better, like my diabetes, like my liver function numbers, but am I making some of my cholesterol worse? And the answer from the paper is no. Again, the LDLP or ApoB did not change over the year. So that is a really important take-home point from this study. So that's specifically looking at cholesterol. So what we see is dramatic improvements in atherogenic dyslipidemia, no change in those really important LDLP or ApoB numbers, and we see a really big improvement in blood pressure, a key risk factor for cardiovascular disease. And here's the important point. Not only did we get to see patients' blood pressure significantly decrease, but they were taking less medication for it. So we were making it better while being able to remove medication. So again, a critical risk factor. The other one that is really important to make note of is inflammation, because it is important for everyone to understand that at every phase of the development of cardiovascular disease, inflammation plays a key role. So what happens to the inflammatory markers with any intervention is really important. And the best one to look at specifically cardiovascular risk is one called C-reactive protein. And Catherine, in this study, our patients decreased their C-reactive protein by 40%. Wow. So again, another really important cardiovascular risk factor made better by the Virta treatment.